Good afternoon, everyone, and welcome back. Feel free to introduce yourselves in the chat box. Let us know where you're joining us from today. So for this session, we're joined by Alice and Nadine from Freedom from Torture. I will hand over to both of them now to introduce yourselves. So over to Alice.
Hi everyone, my name's Alice Porter, and I am the Wellbeing Lead for Freedom from Torture.
Hi everyone, my name is Nadine Tunasi. I'm the Survivor Activism Manager at Freedom from Torture.
Great. Thank you very much both, and thanks for being here. So just before handing over to Alice and Dean, I need to share a few house rules and pointers for today's session. So the session is being recorded and will be uploaded to watch on demand at a later date. The slides and other resources will also be made available to you, so don't worry if you've missed anything. During the webinar, please ask plenty of questions in the Q&A section to address at the end of the presentation, and feel free to share any comments, experiences, or top tips in the chat section. Finally, if you encounter any sound or image issues, please let us know in the chat and we'll do our very best to get the session back to normal as soon as we can. So without further ado, I will hand over to Alice.
Thanks very much, James. Hi everybody. Nadine and I today will be talking on wellbeing in service delivery. Just trying to go next. There we go. The session will explore Freedom from Torture's journey towards the integration of a systemic trauma-informed approach to wellbeing within our organisation. And as we go through our presentation, we would really encourage you to think about the context of your own organisation and how aspects of our learning and thinking could be applied within your own setting. But firstly, just a little bit about Freedom from Torture. We were established in 1985 as the Medical Council for Victims of Torture. We provide psychological, medical, legal, and welfare support to survivors of torture. And led by torture survivors, we campaign against torture and for the rights of survivors seeking asylum within the UK. And we employ survivors, psychologists, therapists, psychiatrists, lawyers, social workers, doctors, and administrators in service delivery roles, as well as a range of other roles in advocacy, fundraising, campaign, and support functions. And every one of those roles is really integral to our delivery of services. So not only those who are kind of frontline and front facing, but also those involved in kind of fundraising, campaigning, and supporting functions. And we have 148 paid staff and 90 volunteers. I'm aware that this may be more than the number of staff that some of you joining us today have, and it may be less. But I really believe that what we're going to talk about today can be applied. Kind of similar thinking can be applied within kind of organisations of any size. And I hope that you find it useful as well. And currently, we have 4 pillars to our strategy. We have changing lives, changing the system, survivors driving change, and changing ourselves. And Nadine and I are going to focus on the final 2 pillars, survivors driving change and changing ourselves, because those 2 are kind of the most relevant when we're thinking about well-being. I'm going to talk first on changing ourselves, and then I'll pass over to Nadine, who will talk on survivors driving that change. But when we're thinking about well-being and well-being in service delivery, I just want us for a moment to think about that metaphor that we often hear in like popular culture about filling up your cup or having an empty cup. And we can think about like pouring that water out as if it's, our staff doing their jobs, delivering that service, and that water is pouring out. And if it's not refilled, then at some point the cup is going to be empty and that cup can pour no more water. But it's not only that cup pouring out water that we need to think about when we're thinking about well-being and about supporting our staff. It's also about the other things. There are lots of other things that will impact how quickly that cup empties, such as like how quickly that cup's pouring out the water, if there are any holes in the cup, how big the cup is. There's a range of different things that would impact that, just as there is a range of different things that may impact well-being, not just kind of the job itself that people do. And so at Freedom from Torture, there are some key things that we've really identified as impacting well-being for our staff. Now, some of these you might recognise as being similar to your own organisations, but some of these might be specific to freedom from torture. And I really encourage you, as I talk about these ones, for you to think about your own kind of context. So at FFT, there are funding and financial challenges, and this is something that is kind of sector-wide, but it is something that does impact on wellbeing and impact on staff's ability to deliver services. There is kind of in line with that an increasing need versus limited resources. For instance, we may have to close our referrals at times because the resources are too limited. And then the impact that has on the well-being of our staff that are trying to provide those services can be huge. Looking outside of freedom from torture, the kind of hostile external environment and political context can have a massive impact on well-being. We saw it last year in August. We felt it very acutely with the far-right riots, and then kind of an increasing anti-immigration rhetoric being used, like in the UK and all around the world, and the election of kind of more far-right politicians, again, really, really impacting our kind of staff and our clients as well, and kind of everybody involved in that service delivery. Our workforce community, we also need to consider when we're thinking about well-being, and I mean this kind of in two different ways. At FFT, and Nadine is going to speak a bit more on this later, but we are wanting to employ more and more survivors to kind of lead us in this work, and that is something that we need to be conscious of so that we can ensure that our wellbeing provision is adequately supporting these individuals. And also, everybody that joins Freedom from Torture joins it because their values really strongly align with the values of the organisation. But that does mean that there is a possibility that staff can become quite enmeshed with the work, and therefore really struggle to separate their work from their kind of home and personal life. And this can quite significantly impact well-being. So it's something we consider. And then finally, kind of repeated exposure to trauma for a lot of our staff. This might be through client work directly, maybe through referrals, through advocacy work. There's a load of different ways that our staff might be impacted by their work itself. And so in light of these considerations, Freedom from Torture developed a trauma-informed approach in 2020, which was an attempt to recognise the impact of the work on staff. And it took inspiration from healthcare and education settings to really try and embed the principles of trauma-informed care that are informed by psychological knowledge of the impact of working with trauma. But we reviewed this in 2024, and together, kind of through a very, very participative process, we have developed a slightly different way of looking at it, more of a systemic approach that is still aiming to embed those aspects of trauma-informed care, but that recognises there's both an organisational and an individual responsibility for wellbeing, and that there are interconnecting systems within freedom from torture and outside of freedom from torture that all have different relationships and have an impact on well-being. So it's so important when we are considering well-being within service delivery to think about the interconnecting relationships between all the different stakeholders involved. If we are just trying to address, if we just address one small bit of well-being, one intervention, whilst this will have a positive impact, it may well not be an ongoing long-term impact if kind of the wider system is not thought about. So what does that actually mean? So for us, the vision has been to develop a flexible and dynamic approach that recognises wellbeing is not one size fits all. It changes over time, and it's influenced by multiple different factors like cultural, historical, environmental, personal, social, so many things impacting it. And we are aiming to introduce only interventions and strategies that are co-produced and co-developed. And this would be generally with myself and the Wellbeing Working Group, which is individuals from across the organisation coming together to try to support and improve wellbeing. And we're trying to embed a sense of belonging and purpose for every individual within freedom from torture. Embed wellbeing into strategic decision-making processes. So ensuring that wellbeing is not kind of an afterthought, but it is thought about alongside all of those other organisational priorities. And then finally, trying to develop a culture where we recognize the impact of the work that we do and also the impact of life experience. So for us, I like to think of it as though we're thinking about building blocks for well-being. So if you were building something, you wouldn't build it like top down because it would fall down. You'd build it from the bottom up, right? And so we use this image as kind of what our framework looks like. We've got the triangle within the circle. The circle is like the system of freedom from torture. Around the outside are those trauma-informed principles. And then if we're looking at the triangle, along the bottom is freedom from torture's values. And then we have our culture. So we're really trying to create a culture that is conducive to good well-being at work. And without this, we can add on the other things, but they're not going to have that long-term real change. So that trying to shift that culture might look like compassionate communication between everybody, including towards ourselves, being survivor-led, having visible and accessible leadership, and ensuring that our staff can come to work and feel safe and feel that they can bring their whole selves to work. And we do this through the work of our Race and Inclusion Task Force, who have a lot of kind of satellite groups as well, like our Pride group and our Neurodiversity group. They really work to develop our EDI strategy and to kind of take that work forward. We then have our structure, which would be like our processes, our ICT, our policies, our inductions, and ensuring that all of these are conducive to good well-being. They are not negatively impacting well-being. We then have our organizational resources, and these might be things that could start to cost money, but also we're always looking for opportunities to kind of share specialist knowledge internally. So we recently identified our clinical administrative team as perhaps being a team that might need some more specific support around handling distressing calls. So we looked at a couple of our clinical psychologists to develop some training for them. We also have wider wellbeing training that I will develop if we might identify there is a need within the organisation. And we have clinical supervision for all of our clinical staff. And then our wellbeing working group as well. And then kind of on top of all of these building blocks is the individual wellbeing support, like our employee assistance program and our mental health first aiders. So you can see we're really trying to build things up from the bottom up to ensure that there is long-term, like substantial, significant change for wellbeing. Now, these are some of the challenges that, we come across trying to do this. It's not easy, and we're never really, going to get there and just tick it off. It will always be a work in progress. I'm not going to go through the mitigations we've tried to put in place because I'm conscious of time, but there are challenges, and I would really kind of encourage you, if you're looking to try to think about your well-being within the organisation in this way, try to kind of preempt some of these challenges and look at how you could mitigate them. And so what comes next for us? Well, we will continue to be getting feedback from our staff. It's an ongoing process. It's dynamic. It's live. We will never get there, and we will never just tick it off and say it's done. And we will be using that feedback to come back to the Wellbeing Working Group to try to identify opportunities for further development, and then establish ways to meaningfully measure the impact of any changes or interventions. So for instance, right now we're actually looking at trying to identify an organisational definition for wellbeing, so that we can have something that is built by the staff, it's defined by the staff, but that we can come back to as kind of an ideal for what staff are meaning when they're talking about wellbeing. And then finally, sharing best practice and sharing our learnings, what's gone well, what hasn't, with others within the sector that can then feed back in to the feedback, and we can continue the cycle. So that is everything from me, kind of on pillar 3 of our strategy, but just handing over now to Nadine for pillar 4.
Thank you, Alice. Yeah, thank you so much. I think that was very good. Even as somebody who works at Freedom from Touch, I found it very interesting listening to you.
Thank you.
I mean, Freedom from Touch is a very important organization. I think it's worth for me to say that I am an ex-service user. of freedom from torture. And I know that as the service user, ex-service user, well-being when I was receiving therapy was something that was really very important. It was very important in my recovery. And, I'm very proud to see that, as an organization, as a working staff, this is still an important theme for us. So the strategic goal that I'm talking about is the survivor driving the change. And I'll be talking to you through our network work, the survivor activism. And I'm just going to try and, really tell you about how, well-being fits a little bit in the work that we do. Our theme sit in the Directorate of Survival Leadership and Influencing. So we work very closely with our asylum advocacy work, which is very much about influencing the work that we do in terms of like ensuring that people who arrive in the UK, torture survivor, as you probably know, we are an anti-torture organization, but people who flee torture, like myself, need to be able to seek protection. So our team will very much work with our colleague in the asylum advocacy work to ensure that we advocate and, in promoting that, as survivor of torture have access to protection, but also in the accountability team where we continue to ensure that, the UK as a country, as a leader, but also other country, uphold their commitment to the absolute torture ban. So this work was very much led with the accountability theme. Can I have the next slide, please? And this is the quote of from my colleague Kobasi Awusu, who is a founder of the Survival Speak Out Network. So after finishing therapy, I asked myself, what am I going to do next? There was very much a sense, I felt almost like the obligation and the duty to make sure that, I use my experience and my voice to advocate against torture. But also, I felt like in this country, then over 20 years ago, I didn't feel like people really understood, the challenges that torture survival, went through. And in my quest in finding my next thing to do in this country, after joining the Right to Life, I joined the Survival Speak Out Network. And my colleague Kobasi Awusu, who is a founder, co-founder of the Survival Speak Out Network, said one of the most powerful ways to fight torture is to empower survivors to become agent. So our work is very much about how do we take people from moving from that journey of being service user, passive, agent, and turning them into active agent, where they can have meaningful participation and contribution, in the things that have affected them. So my role as a survivor activism manager is to lead with colleagues about the operational work of the Survival Speak Out Network, which is a network of people who have finished therapy at Freedom from Torture. We only recruit within Freedom from Torture because our members want to ensure that, it's a safe space and, people have been in therapy and we're sure that there's certain like a sense of process that people have been through. We don't feel like it's probably safe to recruit them in the network outside. So people have finished therapy, and if they wish, to become advocates, they can join our network or the Survival Speak Out Network. Quite often, clinician, in the panel handover, moving on process, we refer survivor to our services. And then there was a discussion, many years ago, how do we make sure, because it's always about inclusivity, how do we make sure that, people are well represented? Then there was also a need to have a network of young people. So the YOS network is the network of survivors aged 16 to 25, and they have the specific challenges. And I think it's worth saying that one of the key, principle we try to promote is, nobody is ever fitted to speak about your own issue than yourself. So even as a survivor, I'm very conscious that I did not come in this country as a minor, so my experience will be very much different. So who is best placed, to promote or to campaign, against the challenges that young people who have tried to seek protection in the UK face? Of course, the young people. And then we've seen a lot of people, who engage in our work, torture survivor, non-torture survivor, but people were fled, war and conflict. They wanted to be part of our work. Then the idea of starting the network called One Strong Voice, which is the UK network of networks. So individual, from advocate and from network and join. We mainly campaign on the issue of immigration and asylum system in the UK, whilst in the Survival Speak Out network, we talk about asylum system and torture. So this is a very unique place. But both yours and the Survival Speak Out network, people will be recruited within Freedom from Torture. But with One Strong Voice, we had the ability to recruit outside Freedom from Torture. Next, please. The value of freedom from torture are compassion, resolve, empowerment, and hope. And I think that, survival activism is very much about empowerment. I remember in my early days in my advocacy, when I wanted, quite rightly so as well, at some level, when I wanted to go and speak, people would say, give me the notes for me to go to an event and speak, or people would tell me what I needed to say. And then one day I said to myself, feel like I'm not really hearing to myself, and I'm not listening to the voice within, and I'm not able to express the challenges that I think that I've seen and I've experienced is, over the years when people need, support. Yes, we want to do that, but really empowerment is about ensuring that, people are becoming active, agent. They are able to use their voice and really best place, to be the one sitting on the table, able to feed into the policies that are influencing them. So really, we try to make sure that empowerment is a key thing for us. Even within ourselves, we constantly have to really check and ensure that, how do we make sure that, we are not taking the power away from our network member. Even as a staff, I'm very conscious all the time as the person who is leading this work. I might easily, be telling people what to do and really just remembering all the time how we are, facilitator, but also providing the space. So with our survival activism work, we've been able to really, it's about providing a platform that is safe, but also people, feel like they are in control. For example, in the Survival Speak Out network, the network member, although I'm a manager, I don't manage. I'm not a manager of the network member. I manage my colleague, and my colleague who is a director is not a director for the network member, but he's a director for the work that he does at Freedom from Torture. So really putting those boundaries and establishing, good principles that really let people know that, when they come into those meetings, we are all equal and are able to contribute equally. And really ensuring that, when we speak about our messaging, when we are promoting this safe, place that we want people to have access to in the UK, how do we do this in a compassionate way? How do we make sure that, we in our messaging and, we're ensuring that, we can actually reflect the suffering of the people that have been through, torture or any difficult situation. And really, we want to make sure that, we give people hope. I can tell you, survival activism is not always about achieving the result that you've seen. We have had a lot of wins, but we also did not always have them. But at least people have told us, I have hope that there are people who are not just watching, they are doing something, and then maybe helping, to help us see the change that we want to achieve. Can I go to the next slide? And maybe I won't talk too much about this part, but really, the key thing is about us constantly investing in building our network. So one of the things that we do is investing in people. Network member are a volunteer. But also, when you have established that somebody have contributed quite substantially in your work, how can you put things in place to make sure that you don't exploit people because they are so passionate about the things that you are doing? And we invest in our people, making sure that people, they don't just turn up and, do things for you as an organization or for your cause, but also make sure that people have the capacity, build, as a result of taking part in your work. And so, yeah, we want to continue to build this political and public support because, right now, and it's been like that for many years, but it's getting worse. We want to continue to ensure that, we do have this, political and public support that is compassionate and quite very importantly, fair. And on our torture and accountability work, making sure that, we continue to stand and speak against torture. Next, please. I'm conscious of time. I've already touched, maybe I'll just talk about, the key principle for us is like our motto, nothing about us without us. So what we do is, let's say we want to campaign against the policy that the government have put for refugee and asylum seeker. Who do you think is best, to come in and input into that policy? That's when we try and bring Survivor. And here I have some of the, I'll touch quickly on that. We had, something to do with well-being. The narrative that we hear a lot about refugee and asylum seeker have led to people really having their mental health being impacted. So here we try to have a campaign where we had the change of narrative. We have this fake newspaper, but with the narrative that we wish to have, from the audience and the public. And this newspaper were shared. We call it Medbo, and they were shared at the Conservative Party conference. And it's trying just to a way of showing, what, you can talk about as refugee and asylum seeker, but more positively. And the last one, please. Here, unfortunately, we're not able to get the video for some reason. It's been deleted. There was a Rwanda policy, and a lot of people were impacted and affected. And our colleague went to the airline aviation conference and disrupted the conference just to really say, you know what, we were in that position. And if this policy was to be applied today, we will be the one, sent to Rwanda. And as you probably know, we've successfully managed to have this policy a ban, and nobody was sent to Rwanda. So on that note, I'll leave it to that. Thank you. Do we still have time? I can talk about, I'm conscious we do have our Q&A, and maybe to finish, yeah?
Oh, go ahead. No.
Yeah. Maybe to finish, I'll probably say, what does good contribution look like from survival? It has to be meaningful, safeguarded. Meaningful is like the way you involve people in your work. We don't want tokenism approach where people just put you in front of the screen, go and say this, or without involving you properly. It's about, valuing people's contribution, letting be part of the work from the ground. And also safe. If it's not safe, don't let people get involved. People need protection. Sometimes people have identity issues. They don't want to be found out. They don't want people from their own country, to know that they are doing this. So you want to make sure people are protected, and also prepare people and invest in them. And then now time for questions. Sorry, I had to rush the
Perfect.
last part. Yeah, thank you.
No, that's fine. It's amazing to see the work that you're doing. So thank you both for sharing that. We've had two really good questions that kind of go hand in hand. And so one person said that they work with their own service users, which creates a very passionate and empathetic team. But then they're interested in ways we can support wellbeing in this case. So the other side of that question was, I work for a cancer charity, and we have some questions recently about people delivering our services who are living with cancer and the impact on their wellbeing whilst working for us. Could you go into more depth about the approach to lived experience staff, in your case, survivors?
I guess that would be a question for me, yeah? Okay. I think, you need to, so for example, when we are trying to consult with people, thank you, that's a very good question, I have to say. One of the things I said, how do you make your contribution, how does good contribution look like? You have to prepare people. And sometimes information are quite, technical. We make sure that people are prepared. You prepare a briefing for people to understand, and how do you make the information accessible to them so that they are able to contribute, to the work that you want to do. But also, how can you support them? If you want people to come and attend an event when you are the consultation and the view, is that a thing that you can do? For example, support with logistic. If they live far away, is there an hotel that you can book around to make sure that they don't struggle too much traveling? If they have special needs, how do you make it easier for them to be part of your work, without suffering too much, despite the challenges they are facing? So really, it's about meeting people at a different level, but also supporting them. Most importantly, also, what is it there for them? Quite often we want to extract information, but how do we make sure that while they are supporting you or they are taking part, they can also get something out of it? I think for us, really making sure people can maybe become an expert and learn from the process is very important. I hope I've answered that. Yeah.
No, that was a great answer. Thank you for that. One thing that stood out to me in the presentation was the wellbeing working group that you have set up. So yeah, you've got those great structures set up. I was wondering how someone would go about it if they were just starting out and they wanted to get that going in their own organization. Do you have any tips for how people would start?
Yeah, absolutely. I think it would depend on the size of an organization. If you're probably on the smaller side of an organization, it would be about, first of all, I would speak to those, like your senior management. If you are senior management, wonderful. But it's really important to have those on the senior management team on board if you are going to start something like this. So initially, that's where I would go. And then it's really about like word of mouth. So for instance, when I first joined Freedom from Torture, which was about 2 years ago, we had not a lot of people within the group. And then it's really been through word of mouth, people actually hearing what you are doing. And when you're talking about well-being in maybe like a all staff space, saying, if you're interested in hearing more about this, we're meeting next week or whatever. But really using your word of mouth, trying to find your allies within the organization who are also really interested in this. And then it will grow from there. But my one thing that I would say would be absolutely make sure you've got, that the kind of senior management on board, not necessarily attending every meeting, but definitely kind of interested and invested so that it can kind of lead to meaningful change.
Definitely making sure you've got a voice.
Exactly.
Perfect. We've had another one submitted. I'm interested to know if you have any digital tools to promote well-being around workload or administrative burden, or if not, is this something that you've considered?
Absolutely. It's something that it comes up all, workload is something that comes up all the time. And
Mm,
with maybe more limited resources or with funding challenges, it's becoming like an increasing challenge. One thing that we're currently exploring is the use of AI and how that can help with workload. So for instance, in like the human resources team, they spend a lot of their time analyzing things. And we're exploring right now, I think we worked out like 12 of their days last year on one survey.
mm,
And so we're exploring how AI can support that. And we're currently trialing that with like different individuals within the organization with the hope that we can expand it. So
yeah, definitely an interesting time on that front for sure.
absolutely.
Um, I also noticed that you listed wellbeing funding as a possibility. Where
Mm.
could people turn if that's the sort of thing that they're looking for? Is there maybe a database or somewhere they can go?
So currently, I'm yet to find a centralized database. But what
Mm,
I would recommend looking is like councils or a city hall website. For instance, like we had some really great free training that was done by the city hall on like reviewing our policies to be more in line with the trauma informed lens. Um, that's for one. Another is if you've already got funders, sometimes they will offer like some separate, a little bit of ring fence separate funding specifically for wellbeing. So that's where we found quite a few tiny little pockets. But it's really, there's not yet a centralized hub that I've found. So really research, keeping your eye out, and also speaking to other people.
brilliant. I'm afraid that's all we've got time for. So thank you both, Alison and Dean, for joining us today. Our next session will start shortly and is Mission Meet Momentum, how partnerships can reimagine service delivery at scale with PIR. See you soon.
Thanks so much.
Thanks both.